Hello everyone, my name is Neil Cacciapilli and I'm from Nashua, New Hampshire.
My name is Alex Wu and I am from Lexington, Massachusetts.
I'm Samuel Chang and I'm from Dallas, Texas.
I'm McShea and I'm from Littleton, Massachusetts.
And I'm Joanne Park from Bloomington, Illinois.
And this is our team, NASA Junior.
This year, our team took on the challenge of using images of lung tissue to develop a model which could accurately and efficiently diagnose a subject with lung cancer. Lung cancer is the second most common cancer and most deadly cancer in terms of sheer volumes of deaths. The disease kills far more patients than prostate cancer and breast cancer combined, although more patients are diagnosed with prostate and breast cancer. And there have been approximately 135,000 US deaths from lung cancer in 2020, which is about 22.4% of the cancer deaths in 2020 so far. Also, we have familial connections to the disease, so we wanted to take on this challenge.
Specifically, we looked into two main types of lung cancers, which are squamous cell carcinoma and adenocarcinoma. These make up about roughly 80% of all lung cancers. The main ways people take images of lung cancer are via magnetic resonance imaging, or MRIs, computer tomography or CT scans, X-rays, or tissue sampling, also called biopsies, which are used to create histopathological images. While there are many pros and cons to these imaging methods, all methods are susceptible to human error, and it's common practice for at least 2 doctors to review scans. This second review further increases time until diagnosis and often requires for more tests due to difference in opinions between doctors. For example, diagnostic agreement between doctors for classifying adenocarcinomas and squamous cell carcinomas were shown to be relatively low.
Besides efficiency, another reason our method is so useful is that it allows for specificity. Recent treatments tailored to specific subsets of lung cancer have been shown to significantly increase survival time, efficacy, and patient safety. Specifically, differentiating between squamous and non-squamous, non-small cell lung cancer can drastically change choice of therapy. The end goal of our model is to act as a replacement for a second doctor's opinion, which would reduce diagnosis time and costs. Therefore, to speed up the process of getting a diagnosis, especially during this global pandemic, and to save money for patients, our team focused on using images of lung tissue, also known as histopathological images, to train a model using machine learning. Tissue sampling is how a majority of lung cancers are diagnosed, and the images are incredibly clear. For example, machine learning algorithms have been used on histopathological images to assist in cancer diagnosis, such as colon cancer, breast cancer, prostate cancer, and have been used in tumor detection, such as brain tumors.
For our project, we employed a KO dataset that is perfect for our purposes as it is vast, well organized, and minimally, if at all, used. Thus, we can use this dataset, which contains 15,000 histopathological images related to lung cancer, to bring new, helpful information to light. Our approach uses convolutional neural networks with pre-trained ImageNet weights, a process called transfer learning. We also experimented with normal convolutional neural networks without pre-existing weights, but found transfer learning to be more effective, in line with research on similar topics. Using this model, we can input a dataset with labels such as benign, adenocarcinoma, or squamous cell carcinoma, and the algorithm will assign importance to various features of the image and learn these characteristics to associate them with specific labels. Once trained, it will hopefully be able to take in new images and correctly assign them to their right labels.
To better understand how this works, take this image of a person with adenocarcinoma, lung cancer. We can use this image to train our model. During training, our convolutional neural network will look at tons of features in this image, such as brightness or clusters of color or texture. And when we test the model, if we feed in an image similar to this, but say slightly rotated, our model will say, hey, this image has similar features to that of someone with adenocarcinoma. Thus, this person is at risk for adenocarcinoma. Keep in mind that this is a very simplified example and that our model looks at tons and lots of more features besides just brightness or clusters of color. While this is just our process, in our live presentation, we will go into further detail about the kind of model we used, as well as the speed and accuracy of our model. Additionally, we will perform a live demo of our model in action. Thank you.